That small bag of baking soda sitting in your kitchen might be one of the most underrated health helpers you've ever owned. Do you have a little white packet tucked away in your kitchen cabinet? It's cheap, simple, often forgotten. Most people think baking soda is just for making bread rise, cleaning coffee stains, or freshening up the fridge. But what if I told you it also holds a secret list of powerful health uses, especially for seniors? Today, we're breaking down the 7 surprising ways baking soda can benefit your health, starting with one of the most common issues in older adults: acid reflux. Let's begin with use number 1. 1. Relieving acid reflux. Baking soda helps neutralize stomach acid naturally. Have you ever eaten a heavy or greasy meal and felt a burning sensation in your chest just afterward? Maybe when you lie down, you feel acid creeping up your throat, or you wake up with a bitter taste in your mouth. That's acid reflux, medically known as gastroesophageal reflux. It's a condition that becomes more common with age. As we grow older, the muscle that keeps stomach acid in place, called the lower esophageal sphincter, weakens, allowing acid to flow backward. This can cause burning in the chest, heartburn, sour or bitter taste in the mouth, chronic cough or throat irritation, sleep disturbances due to nighttime reflux. Now here's where baking soda comes in. Baking soda, or sodium bicarbonate, is a mild alkaline compound. When you dissolve it in water and drink it, it reacts with the hydrochloric acid in your stomach. This neutralizes the acid and brings quick relief. Many people have found that a small dose of baking soda water can relieve heartburn in just a few minutes. That burning sensation in the chest eases. The sour taste fades. You may even burp a little. That's the carbon dioxide released during the neutralizing reaction. How to use it safely. Mix 1 to 4 teaspoons of baking soda, about 1.2 grams, in half a cup of warm water, about 120 milliliters. Stir well and sip slowly. Wait 10-15 minutes to see if symptoms improve. Important precautions. Don't take it on an empty stomach. Do not use this method frequently. It's for occasional relief only. If you have high blood pressure, kidney issues, or are on a low-sodium diet, avoid using it altogether. If symptoms keep returning, see a doctor. You might have a more serious condition like GERD or ulcers. Why does it work? The chemistry is simple. Baking soda is a base, and stomach acid is, well, acid. When combined, they create a neutral reaction, producing water and carbon dioxide gas. This reduces the acidity of your stomach temporarily, making you feel better fast. It's a bit like putting out a small fire with water. Quick, effective, but not a long-term fix. And that's key. Baking soda is a great emergency aid, not a daily treatment. If you're relying on it often, you need to address the root cause, not just the symptoms. Recap. Baking soda isn't just for baking cookies. Its first health use is for occasional relief from acid reflux or heartburn. Cheap, fast, and simple if used correctly. But this is only the beginning. In the next section, we'll explore how baking soda is quietly being used to support kidney health, especially for those facing chronic kidney disease or early-stage kidney function decline. Doctors are starting to recommend it in low doses for very specific patients, and you might be surprised to hear why. Stay tuned. Baking soda isn't just a kitchen cleaner. It's quietly helping some people manage kidney health and urinary discomfort. In the first part, we talked about how baking soda can help with acid reflux. But the uses don't stop there. In fact, baking soda has been used in medical treatments for years, though most people never hear about it. Today, we're going to look at 2 important ways baking soda may support the body: kidney function and mild urinary tract irritation. Let's explore each one. 2. Supporting kidney function. A surprising tool to ease acid buildup in the body. For people with chronic kidney disease, baking soda has played a quiet but important role. Normally, our kidneys help regulate the body's acid-base balance. They filter out acidic waste from food and metabolism. But when kidney function starts to decline, acid can build up in the body, a condition known as metabolic acidosis. This condition can lead to fatigue, weak bones, muscle loss, faster progression of kidney damage. Baking soda, also called sodium bicarbonate, is a mild alkaline substance. When used correctly, it can help neutralize the excess acid in the blood and reduce the load on the kidneys. In fact, some doctors prescribe a form of baking soda, called bicarbonate tablets, to patients with early-stage kidney disease. A British study even found that patients taking small daily doses of baking soda had slower kidney decline compared to those who didn't. But let's be clear, this is a medical treatment that must be done under a doctor's supervision. Important notes: do not self-treat kidney problems. With baking soda dosage is based on blood tests and must be calculated by a physician. If your kidneys are healthy, there's no need to take baking soda just in case. This is a very specific use for very specific people. So who might qualify? Patients with diagnosed chronic kidney disease, those showing signs of high blood acid, metabolic acidosis, individuals already prescribed bicarbonate by their doctor. Used properly, baking soda can help slow kidney damage, but it's a tool, not a cure. 3. Easing urinary discomfort. Soothing relief for mild burning or irritation. Another little-known use of baking soda relates to urinary tract discomfort, especially in older women. If you've ever experienced a burning sensation when urinating, frequent or urgent urination, cloudy urine or unusual odor, then you know how uncomfortable even mild urinary irritation can be. While baking soda cannot treat infection, it's not an antibiotic. It can help neutralize urine acidity, making urination less painful. Here's how it works. When urine is too acidic, it can irritate the lining of the urinary tract. Baking soda, being alkaline, may help slightly raise the pH of the urine, reducing that burning feeling during urination. Suggested method for short-term use only. Mix 1 teaspoon of baking soda in 1 cup of warm water. Drink once a day, ideally after a meal. Use this method for no more than 2 to 3 days. If symptoms continue, see a doctor right away. This method is meant for mild irritation, not serious infections. If you have fever, back pain, or blood in your urine, don't wait. Get medical help. Who might benefit from this? Older adults with occasional urinary discomfort, women who experience mild symptoms during early urinary tract irritation, those looking for a gentle home remedy before seeing a doctor. Again, this is not a cure. It's a way to ease symptoms temporarily while your body heals or until proper treatment begins. Quick recap. Baking soda can help reduce acid buildup in the blood, potentially supporting kidney function in early-stage kidney disease. It may soothe mild urinary discomfort by neutralizing acidic urine, especially in older women. But in both cases, baking soda should be used carefully and in the right situations. It's not magic, but when used wisely, it can be a gentle tool to support health. Have you ever heard of using baking soda for these conditions? Do you know someone who was prescribed bicarbonate by a doctor? Let us know in the comments. Your story might help others make more informed choices. In the next section, we'll talk about some even more surprising uses. How baking soda may help with gout pain and even oral health. Stay with us. You won't want to miss it. Surprised? Baking soda may help ease gout pain and improve oral hygiene. 2 struggles many seniors face. So far, we've covered how baking soda can help with acid reflux, support kidney function, and ease urinary irritation. Now let's look at 2 more common issues among older adults: gout and oral health problems, and how baking soda might offer simple support right from home. 4. Easing gout symptoms. A natural way to support uric acid balance. If you've ever woken up in the night with a sharp pain in your big toe, swollen so badly even the bedsheet hurts, you're not alone. That's a classic gout attack, caused by high levels of uric acid forming crystals in the joints. This leads to intense pain and swelling, redness and inflammation, difficulty walking or moving the joint. Where does baking soda come in? Baking soda is an alkaline substance, and uric acid is, as the name suggests, acidic. Drinking baking soda dissolved in water can help temporarily raise the pH level in your blood and urine, making uric acid more soluble and easier for the kidneys to flush out. This doesn't mean it will cure gout, but it may reduce uric acid crystal buildup, ease joint irritation, shorten the duration of mild flare-ups. How to use it? With caution. Only during non-acute periods, not during severe attacks. Mix 1 teaspoon of baking soda into a cup of warm water. Drink after meals, no more than 2 to 3 times per week. Always check with your doctor if you have high blood pressure or kidney issues. This method is supportive, not a replacement for gout medication or diet changes. Lifestyle pairing. Avoid high purine foods, organ meats, shellfish, alcohol. Stay hydrated. Get regular checkups for uric acid levels. Baking soda can be part of a gout management routine, but only with medical awareness and moderation. 5. Oral health, helping with ulcers, bad breath, and gentle cleaning. Let's shift to something more familiar, your mouth. Many older adults experience bad breath, mouth ulcers or canker sores, bleeding gums, or oral sensitivity. These issues are often caused by imbalanced pH in the mouth, poor hygiene, or inflammation. Baking soda can help by neutralizing acid in the mouth, reducing bacteria growth, soothing minor ulcers, and freshening breath. Simple methods to try: mouth rinse. Mix 1/4 teaspoon of baking soda in a glass of warm water, swish gently for 30 seconds, then spit rinse with clean water afterward. Use once or twice a day. Mouth ulcer relief. Dab a small amount of diluted baking soda water on the sore area using a cotton swab. Helps neutralize acidity and reduce irritation. Use for no more than 2 to 3 days at a time. Who benefits from this? Seniors with frequent mouth ulcers, people with dry mouth or oral sensitivity, anyone looking for a gentle, natural oral rinse. Baking soda should not replace toothpaste, but it can be a helpful temporary aid in managing symptoms. Dentists often recommend baking soda rinses after dental procedures to help cleanse and soothe the mouth. Just don't overuse it or swallow it. Quick recap. Baking soda may support uric acid balance, helping reduce gout flare-ups when used properly. It can also improve oral hygiene, reduce bad breath, and soothe mouth sores by restoring pH balance. All of this comes from one simple ingredient: cheap, easy to find, and surprisingly powerful. Have you ever tried baking soda for joint pain or mouth health? If so, what worked or didn't work for you? Share in the comments and let's help others discover what's practical and safe. In the final part of this video, we'll talk about post-exercise recovery, how baking soda helps soothe muscle soreness, and the big idea: how baking soda plays a role in overall body pH balance. Let's finish strong. See you in part 4. Can baking soda really help with sore muscles? The answer leads us to the bigger idea of body pH balance and your long-term health. Let's talk about something many older adults experience: muscle soreness after mild activity. Maybe you climb a few stairs or go for a brisk walk in the park, and the next day, your legs are sore, stiff, or just won't move the way you want. It's not just aging. It's often the result of lactic acid buildup during physical activity. And yes, baking soda may offer some relief here too. 6. Easing post-exercise. Muscle soreness, neutralizing acid for quicker recovery. During exercise, your body burns energy fast. When your muscles don't get enough oxygen, they produce lactic acid, which makes muscles feel tight, sore, or fatigued. That's where baking soda comes in. Because baking soda is alkaline, it helps neutralize some of that acid in your blood, making it easier for your body to recover. It's not just for athletes. Older adults can benefit too, especially those working to stay active through walking, tai chi, or light workouts. How to use it: mix 1/4 teaspoon of baking soda into a cup of warm water. Drink about 30 minutes after exercise. You can add a bit of honey for flavor if your blood sugar is stable. Limit use to no more than twice a week. Caution: if you have high blood pressure, kidney issues, or heart problems, speak to your doctor first. Muscle soreness that lasts more than 2 to 3 days or includes swelling or fever needs medical attention. 7. Supporting whole body pH balance. The bigger role of baking soda. This final use is less about treating a symptom and more about supporting your overall health. Your body works hard to keep your blood pH stable between 7.35 and 7.45. But a modern diet full of processed carbs, red meats, sugary drinks, fried foods can tip your body toward an acidic state, which may contribute to fatigue, poor digestion, low immunity, chronic inflammation. Adding alkaline-forming ingredients like baking soda in moderation may help buffer acidity and support metabolic balance. It's not about detoxing or miracle cures. It's about small, smart choices that gently support your system. Full recap: let's review the 7 key health uses of baking soda: relieving occasional acid reflux and supporting kidney function and reducing acid buildup, easing mild urinary irritation, helping manage gout flare-ups, freshening breath and soothing mouth ulcers, reducing post-workout muscle soreness, supporting pH balance for whole body wellness. Not bad for something that costs just a couple of dollars and sits quietly in your kitchen, right? Baking soda isn't magic, but it's a low-cost, practical tool when used correctly. Final thoughts and friendly reminders: don't overuse it. Don't take it long-term without medical advice. If you have heart, kidney, or blood pressure concerns, talk to your doctor first. Use it as a supportive remedy, not a replacement for treatment. True health doesn't come from miracle pills or trendy hacks. It comes from small, consistent actions based on understanding your body. And sometimes that means rediscovering the value of the simplest things, like baking soda. Let's hear from you. Have you ever used baking soda for your health? Did it help with reflux, joint pain, or something else? Share your experience in the comments below. Your story might help someone else, too. If you found this video helpful, like the video to help more people discover it. Leave a comment and let us know what topics matter to you. Subscribe to the channel for more practical, senior-friendly health videos. Thanks so much for watching until the end. We hope this wasn't just educational, but also reassuring and empowering. We'll see you in the next one. Until then, take care of your body and take care of yourself.